Hello, my name is Courtney White, and I'm going to discuss schizophrenia today. I've always enjoyed learning about mental health and watching movies like A Beautiful Mind or Shutter Island, things like that are very intriguing to me. So schizophrenia is one of the most severe and complex debilitating mental health disorders. It's progressive. It can be treated but not cured. It causes delusions, hallucinations, disorganized thoughts, abnormal behavior, decreased volition and emotional expression. It affects 21 million people worldwide, which is a very large amount of people. It occurs more in males than it does females. It affects self-awareness. It also affects brain regulation. Brain regulation includes impulse control, judgment, affect, and social skills. The role of an occupational therapist for a patient with schizophrenia can be a lot of things. Often people with schizophrenia aren't able to function in life appropriately. So managing being a parent, having careers, managing personal health, a decline in daily living skills, social skills, and basic self-care skills. They often are homeless. You see them on the side of the street or unfortunately incarcerated. A lot of them have substance abuse. They have poor grooming and hygiene. They cannot live independently. They have impaired academic performance and limited involvement in leisure activities. The main role of an OT is to help reduce or eliminate symptoms and provide environmental supports to improve quality of life. Medication is the primary treatment for people with schizophrenia to help manage their symptoms. I did a little research on an occupational therapist role in mental health and specifically with schizophrenia, and I found a study where the occupational therapist, their role was to work on task performance, cognitive disorganization, and to rebuild and sustain partnerships with others. And the study found that early occupational therapy characterized by one-on-one and nonverbal approaches was the most feasible for patients with schizophrenia. Also, that early occupational therapy intervention is very important so that patients can have more functional independence and maintain their daily lifestyle. And also the cognitive domain was greatly affected with early occupational therapy intervention. The prevention of this disease and disability is not preventable. It's treatable though by using medications. Some have used electroconvulsive therapy and repetitive transcranial magnetic stimulation. This disorder affects family a lot with people with schizophrenia. Majority cannot live alone, and if they do live alone, it's usually not very successful or the best quality of life. I also did a little more research and found that a study done on patients with schizophrenia and the family burden, and the results came back that caregivers said that the highest burden was doing meal preparation, housework, and then managing money when they took care of their schizophrenic relative or spouse, which I thought that was very interesting. But schizophrenic patients need a lot of help, and I think that with early OT intervention it would be very helpful. And then I have my references. Thank you.